Social work in India is a field deeply rooted in the nation's rich history, diverse culture, and complex social fabric. It is a profession and a calling that seeks to address the needs of the most vulnerable, marginalized, and underserved populations. From the bustling urban centers of Mumbai and Delhi to the remote villages scattered across the subcontinent, social workers strive to bring about positive change, uplift communities, and advocate for justice and equality. The origins of social work in India can be traced back to ancient times, when religious and philosophical traditions emphasized charity, compassion, and service to others. Concepts like dana, the act of giving, have long been embedded in Indian society. However, the modern profession of social work began to take shape during the colonial era, influenced by both indigenous reform movements and Western models of philanthropy and social service. Today, social work in India encompasses a broad spectrum of activities and interventions. Social workers engage directly with individuals and families facing challenges such as poverty, illiteracy, unemployment, and discrimination. They work with children who are orphaned or at risk, women who have experienced violence or social exclusion, the elderly who lack support, and people living with disabilities or chronic illnesses. In each case, the goal is to empower individuals, strengthen families, and build resilient communities. Education plays a pivotal role in the development of social work as a profession in India. Institutions like the Tata Institute of Social Sciences, established in 1936, have been instrumental in training generations of social workers. These programs combine academic knowledge with practical fieldwork, equipping students with the skills needed to understand social issues, implement interventions, and evaluate their impact. One of the unique challenges faced by social workers in India is the sheer diversity of contexts in which they operate. India is home to over 1 billion people, speaking hundreds of languages and practicing a multitude of faiths. Social workers must be culturally sensitive, adapting their approaches to fit local customs, beliefs, and social structures. This often means working closely with community leaders and leveraging traditional support systems to achieve sustainable outcomes. Social work in India is not limited to direct service delivery. Advocacy is a crucial component, as social workers campaign for policy changes and legal reforms that protect the rights of marginalized groups. They collaborate with government agencies, non-governmental organizations, and international bodies to address systemic issues such as caste-based discrimination, gender inequality, and access to education and healthcare. The impact of social work in India can be seen in numerous success stories. For example, community-based rehabilitation programs have helped children with disabilities access education and healthcare. Women's self-help groups have empowered thousands to achieve financial independence and challenge patriarchal norms. Grassroots campaigns have raised awareness about issues like child marriage, human trafficking, and environmental degradation, prompting legislative action and societal change. Despite these achievements, the field faces significant obstacles. Limited resources, bureaucratic hurdles, and social stigma can hinder the effectiveness of social work interventions. The COVID-19 pandemic exposed and exacerbated many of these challenges, as millions faced loss of livelihoods, health crises, and increased vulnerability. Yet it was during this time that the resilience and dedication of India's social workers shone brightest, as they mobilized to deliver food, healthcare, and critical information to those in need. Looking ahead, the future of social work in India will depend on continued investment in education, stronger collaboration between sectors, and a renewed commitment to social justice. As India continues to evolve, so too will the role of its social workers, adapting to new challenges, embracing innovation, and remaining steadfast in their mission to build a more just, equitable, and compassionate society.